Great. Thanks, Tatiana. Can everyone see my PowerPoint? Awesome. So we're going to be talking about stages of change today. Jeff is going to be doing a sort of a part 2 to this during the next echo, where he's going to be talking about phases of treatment. So today we'll primarily look at what are stages of change, what do they look like, what are characteristics of it, and then Jeff will talk next echo, how do you respond? So we are sort of going to leave you with a cliffhanger on next steps of this at the end. Looking forward to next time, so that's good. Okay, so I want everybody to think of something. What is one thing you've been motivated to change, and you don't have to tell me, but you have not fully changed yet? So everyone think of something. Something that maybe you've been trying to change for a while. Maybe you're sort of off and on the wagon about it. You've changed it, but then kind of fallen off the wagon. And it's just something you've been motivated to change for a long time, but haven't fully changed yet or haven't sustained. Does everyone have something they can think of? Everyone got something? Okay, now we're going to do a little poll here. I want to know, how long has it been since the very first time you've ever thought about this change? So how long has it been since the very first time you ever thought about making this change? If you could answer the poll. You can see my cat here. This is Mila. She loves the attention. Okay, there's a poll up. How long has it been since the very first time you ever thought about making this change? God, most people participated. A few more are trickling in here.
Huh.
Okay, I'm going to end the poll. Share results. Now take a look at that. We've got 70% of us have been thinking about your change for more than a year. 70% of us have been thinking about the change for more than a year. And 50% of us have been thinking about the change for more than 2 years. 50% of us have been thinking about the change for more than 2 years. So that's a long time. So if we think about that, what do you suppose gets in the way of people changing? And you can feel free to put it in the chat, but what are some things that get in the way of people changing? It takes us a long time to make a change. We're helping professionals, recommending changes to people all the time, yet more than half of us in this room have been trying to make a change for more than 2 years. So yeah, we've got some stuff in the chat here. Comfort, change hurts, schedule, energy, burnout, habits, environment, mental capacity, life transitions, finances, right? Lots of things. Yeah. And what are some things, stubbornness, I like that one. What are some things that would help people make a change? So what are some things that might help you or other people make a change? Feel free to put that in the chat. Having a buddy, that's a good support, right? What else would help? Accountability, smaller goals, right? Goals breaking down into steps. Yeah. Life-changing events, positive social influences, doing with someone, motivation. Yeah. So here's a question for you. No longer changing to daylight savings. That's a good one, Jim. What do you suppose are some things that get in the way and some things that might help the people that you work with change? What do you suppose the answer is for the people we work with? Is it the same? Is it different? What do you think? Same or different? Yeah, all the same reasons, right? The same things that help people and get in the way for us are the same things that get in the way and help the people that we're working with, except that I would argue that there's actually more getting in the way of the people that we work with. We work for PACT teams, so we work with a population that struggles. We work with a population that has significant mental illness diagnosis, functionality, challenges, and they've been through a lot of people, crises, trauma. And so what I would say is, I want you to think about this activity. Next time you're feeling frustrated with a person in PACT for not making a change, I want you to have some humility and think about this activity where more than half of us in the room haven't changed something in 2 years, and most of us have more resources than the individuals we work with. And so what's my point here, right? Change is hard. Change is really hard, and I would argue probably even harder for the individuals we work with, given the challenges that they have. So I just want to start off by normalizing how hard change is and that change takes time. So we're going to talk about stages of change or a stage-wise approach. And I want to start off with some of the guiding standards. Guiding standards, so respect where the person's at. Respect that everybody's probably going to be in a different place. Even if we think or want them to be somewhere, we have to sort of respect where the person's at. And avoid judgment. We don't know everything about the person in their life. There's other things going on. And so try to be aware of bias, be aware of your own thoughts and feelings about it, and avoid judgment. The third bullet point here is one of the biggest philosophies of PACT services. We're encouraging self-efficacy, self-determination, autonomy. People can do it on their own, and we can support them. Patience and flexibility are key. Often when we are working with someone in earlier stages of change, we can become frustrated. And so then we need to step back and be patient and flexible that change is hard. Someone said this in the chat, but small steps, celebrate those. They might be small to us, but they might be big to them, for example. And a step is progress. Consider environmental and social factors. A lot of you brought that up in the chat. Things that get in the way. It's not just motivation. We've determined that. It's not, oh, this person's not motivated. No, maybe they don't have their basic needs met. Maybe they don't have food. Maybe they don't have shelter. Maybe they're dealing with trauma. Maybe they're dealing with significant symptoms. And then monitor, tailor, and adjust interventions. The only reason we look at stages of change, or maybe not the only, but the biggest reason is so that we can tailor our interventions to where the person is at. So let's just take a second and look at the history of the trans-theoretical model of change. This is by Prochaska and DiClemente. There are other models of change that you'll see if you do some research. This is one of the original ones and one of the ones that I think is most popular. The other models of stages of change that you might see are pretty similar. You might notice there are some different names. There's an extra stage or one less stage, but they all have sort of the same idea. But today we'll just focus on this model, which is the trans-theoretical model. So in the 70s, Prochaska and DiClemente did some studies working around smoking cessation. And then in 1983, they presented the first stages of change model. And in 1985, they labeled these stages of change. And then in the 1990s, they were able to apply the stages of change over different pieces of practice, and they started to receive recognition. And then in the 2000s, the model started to be integrated with other practices, became known, other models of change came about, and here we are today. So trans-theoretical model of change, there are 6 basic stages of change. One is pre-contemplation, where the person has no reasons to change. The next is contemplation, where they have reasons to change and reasons not to change. The next is preparation, where they may still be contemplative, but they're more ready and they might have taken a small step or two toward the change. The next is action. They've taken the change or they've started the change. The next is maintenance. They've been successful in the change. I don't know if you guys want to mute. There's someone in background noise. The next is maintenance, where person has successfully made the change. And for most models, they say for at least 6 months. And then relapse, which I don't love that term, but a lot of models just, that's what it's called, is someone has had a setback. So notice that this is a spiral here. These stages of change don't necessarily go in order like this. They can jump around, skip stages. People start, not necessarily at pre-contemplation. Some people never get all the way through all the stages. Some people don't get to relapse, but we'll get to some of those details in a minute here. Relapse actually was an added stages of change. The first 5 were the original stages of change, and then relapse got added in after people started to notice that there was sort of this thing that can happen to people. Okay, so what might stages of change sound like? So I don't have a problem. That would be pre-contemplation. I started research, and these aren't in order. Remember, they're not in order. I started researching AA groups and planning on ways to cut down. Preparation. So this person, they haven't actually stopped drinking. This is about alcohol use, but they started to do things to make that step. I really enjoy drinking, but it's getting me into legal trouble. So this person has reasons to drink and reasons not to drink. They're ambivalent. We call that contemplation. I have not drank in a week. They've stopped drinking. That's action. It's been 7 months since my last drink. This person has maintained the action for more than 6 months. It's now a new part of their life. That's maintenance. I got drunk at a party last night, and that would be relapse. They had a setback. Now, when somebody gets to relapse, this is sort of one of those that overlaps. Someone might revert all the way back to contemplation, preparation. They might get back into action the very next day. It really just depends. We'll talk a little bit more about that in a few minutes. Let's watch a video. This is a video, let's see, make sure I can share sound. This is a video about stages of change. And this particular one is about an individual thinking about dieting. And let me know, thumbs up if you can hear it.
Hey, Christine, part of the video, there's like a black, like big block over a quarter of it. I'm not sure what it is.
Yes, give me 1 second. It's the Zoom. I was trying to put everything on one screen so I wasn't looking away, but I'm gonna have to put them on 2 screens. Did you guys see the most of the video though? Did that only happen some of the time?
I think it was there the whole time.
Oh no. Should we rewatch the I mean, I don't know what you guys saw, but should we rewatch the video?
I'd like to.
Okay.
Yeah.
Sorry guys. Let me know to just unmute and interrupt me if it's still doing it. But I think it was because I had Zoom right next to it. Is it good now?
Yeah.
Successful? Everyone saw that? Awesome. So just an example of, I think, something that a lot of people can relate to or know somebody who's gone through it, or you've gone through it yourself. That cheeseburger and fries look really good. So I commend her for continuing with her change. Okay, we're going to talk about each stage of change and what it looks like. So what are the characteristics of each one? Pre-contemplation. This is not voicing or acknowledging. There could be some reasons to change, but they might be protecting those to stay the same or not saying them. Some people are stuck here due to lack of confidence. Some people are stuck here because they're under or misinformed or uninformed. This is not denial or non-compliance. This is the person is not ready yet to make a change. Denial and non-compliance can kind of sound like negative words, and so we want to try to move away from that and stick with the word pre-contemplation. Typically in this stage of change, the person will benefit from rapport building, engagement techniques, and focusing on what their priorities are. So oftentimes, if somebody's in pre-contemplation about something, it's something that the team feels like they need to change or would benefit them. And we probably may be right that it is something that probably would benefit them, but they're just not there yet. And so we need to look at, what do they want to work on right now? And then maybe connecting this thing that they're in pre-contemplation about to these other goals that they might have. And again, Jeff's going to get way more into how you respond to each. We're just going to really work on today being able to identify each. So I love this quote. When arguing for the status quo, a person is probably rehearsing a script that has been played out many times. There's an expected role for you to play, one that's been acted out by others in the past. Your lines are predictable. If you speak the same lines as others have done, the script will come to the same conclusion as before. What does this mean? It means that when somebody is in pre-contemplation, we often are giving them recommendations, telling them what they should do, telling them how they should do it. And I'm not saying we all do that, but I think we've probably all got stuck in that, or someone has on your team. And what happens when we do that, when somebody is in pre-contemplation, is they push back and they protect what they're doing right now. And then they're arguing for the change they're not making, and it sort of backpedals and doesn't do any good. Essentially, they're used to it from their family, from their friends, right? And they know exactly how to respond to argue for their point, and it doesn't work. Contemplation. This one is characterized by, usually people have changes on both sides. They're usually waffling, they're ambivalent, they're like, I don't know what to do. They're voicing pros, they're voicing cons, they're sort of on the fence, and they're really struggling to make a decision. And they can vacillate, from one side to the other, depending on the moment. This person typically benefits from continued engagement, continued focus on their priorities, and also exploring the pros and cons. This is a great and perfect stage for a practice like motivational interviewing to help the person really hone in on the pros of the change and identifying their change talk. Preparation. This person might actually still be contemplative, but they're further along in that, and they're getting ready to make a commitment. They're getting ready to change. They might not even be voicing many cons. They might even be testing the waters. They're collecting information and resources. So this is a stage where you need to be hearing something that they're doing to identify that they've made the shift. So for example, if somebody is thinking about stopping drinking, maybe they've researched AA groups. Maybe they've cut down 1 day a week. Maybe they're talking to a sponsor. For dieting, maybe this person has researched diets. Maybe this person has met with a nutritionist, right? So they haven't actually done the change yet, but they're taking little steps toward the change. This is a stage of change that can be integral to pause. Usually as providers, we get really excited about preparation. When we see somebody making these little steps, we're like, oh, they're ready. And then we throw them into it. For example, if somebody's, cutting or thinking about cutting down drinking and they're, looking at AA groups, we say, okay, let's get you signed up for an AA group and get you an AA group ASAP. And doing that can kind of scare them off. And so we need to sort of pause in this stage of change and let people ponder and make these steps and support the steps rather than push them forward. So typically these individuals benefit from brainstorming and starting to do some relapse prevention planning. Action, they've made the change. At the beginning of the action stage of change, when somebody has just made a change, this is where people are at the most risk of setbacks. This is the stage of change where people need the most support to sustain the change. Some people present as really independent. I've got this, I'll do it myself, leave me alone. And some are open to a lot of help and will take a lot of help. Depending on what stage of change model you're looking at, this one is also known as willpower. People in this stage of change typically benefit from relapse prevention planning with ongoing modifications. In other words, relapse prevention planning should be a live document, modifying it as things come and go, as they learn what's helping and what's not. We should be bolstering self-efficacy and celebrating success, all of the small steps and big steps. Maintenance stage of change, they've maintained this change behavior for at least 6 months. This is their new status quo. It's the new part of their life. They've developed skills and prevention strategies to maintain the change. Typically, we just continue to look at relapse prevention and modifying that plan as needed, reinforcing the benefits. And this is when we start to identify new goals. Usually when people have sustained a change in their life, they're now ready to start thinking about, okay, now that I've been able to do this, what was that behavior getting in the way of? And what do I want to do now that I wasn't able to do before? And then reoccurrence, otherwise known as relapse, resuming old behaviors, slip up, and then usually these individuals will shift to an earlier stage of change. Now, somebody could have a slip up, for example, have a drink, and the very next day get back to action and say, you know what, I messed up, and do that. But sometimes people have slip ups in this stage of change and they revert back to, let's say, contemplation. And now they're not really sure they want to sustain the change, for example. So this is a stage of change where you need to sort of reassess, where did the person slip back to, and then we respond accordingly. So I think I already said this, but what might be the challenge with the word relapse? The stage of change is technically called relapse. You'll notice I changed it to reoccurrence. What's the challenge with the word relapse?
It's derogatory.
Yeah, it can be seen as derogatory. Now, if this is the client's language and that's the term they use, fine. But what else? It can be seen as derogatory. What else? Negative association, yeah. And then also it can be seen as sort of one or the other, that somebody can really only, exactly, failure, that they can only do accomplishment or failure and that there's nothing in the middle. And there is, because when somebody has a reoccurrence, typically they learn from it. Right, and it's not strength-based and it's repetitive, that's right. Okay, so let's do a little bit of practice here. I don't want to go to groups, it's just not for me. What stage of change does this sound like? Feel free to put it in the chat. Don't want to go to groups, it's just not for me. Yes, pre-contemplation. How about this one? I talked to a couple people going to the group you mentioned to learn more and review the agendas. What stage of change might that be? Yeah, preparation. They're taking little steps to actually go. Great. And how about this one? Groups might be helpful, but I'm not sure I want to spend my time going. Yeah, contemplation, reasons on both sides, they're ambivalent. How about, I've been going to groups for a few weeks now. Yes, action, they're doing it. I've been going to groups for 10 months. Maintenance, yes. I missed group and I'm not sure I'll go back. Reoccurrence or relapse, yes. And then we need to reassess which stage of change they are in after that setback. Great, so let's play a little game, and we can do this in a number of different ways. You can use the little emojis. I struggle with those, but if you don't, feel free. Or you can literally just put your thumb up, thumbs down. So thumb up is for fact, thumb down is for myth. So what do you think? Stages of change typically happen in order in a linear fashion. True or false? Myth or fact? Stages of change. Yeah, that's a myth. Sometimes they happen in order and beautifully, like 1, 2, 3, 4, 5, but sometimes they don't. Sometimes they skip, sometimes they start somewhere else. Yeah. How about this one? It's important we tell the person what stage of change they are in. Myth or fact? Yeah, that's a myth. The stages of change model is actually for us as providers to assess. It's for us to know how to respond. They don't necessarily need to know that. How about this one? Stages of change are often gradual, so don't expect someone to shift quickly. What do you think? Thumbs up or down? And I see people are putting in the chat too. Fact, that's right. They are usually gradual. Now, there are some people that shift quickly, but as you saw from our little activity at the beginning, most of us take a while to make a change. It's hard. Reoccurrence and setbacks can be common and should be normalized. What do we think? That's right. That's a fact. We should talk about that at the very beginning. When someone starts to talk about making the change, we should start to think about relapse prevention planning before they've even made the change. And it should be normalized that reoccurrence is often part of people's journeys and not always. We should stage each behavior, goal, and or substance. What do we think? We should stage each behavior, goal, or substance. Ooh, we've got mixed on this one. So let's pause for a second. This is a fact. So let's take substances as an example. If we have an individual that is using multiple substances, they're likely not going to be in the same stage of change for all substances. We're likely not going to say, oh, they're in contemplation for substance use. So let's just take an example. Maybe an individual uses marijuana and they're in pre-contemplation. They like it. It helps them sleep. They have a card and they're not stopping. It's for them and that's what they do. But maybe for alcohol, they're ambivalent and they're saying, I don't know, I'm spending a lot of money. I've gotten into trouble, but all my friends drink and I really enjoy it. And they're in contemplation. And then maybe for cocaine, they've cut down. I used to use a lot of cocaine, but I've cut down on my work nights and I really want to cut down more. And then maybe they're in maintenance for heroin. Maybe they used to use heroin, but they haven't used heroin in 2 years. So you want to stage each behavior, goal, and or substance. Nobody is a perpetual pre-contemplator, for example. You want to stage each of their goals. Maybe they have 2 or 3 goals on their treatment plan. You've got to figure out which stage of change are they in for each of those goals. They are very likely not all the same. How about this one? People typically make it through all stages of change within a year. What do you think? False. Sometimes that happens, but not usually. And sometimes people don't make it through all stages of change at all. How about this one? In order for it to count, people must be in a stage of change for at least a whole day. What do you think? That's right. That's a myth. They could be in different stage of change for 20 minutes and shift. Stages of change is a tool that should be used independently rather than a team-based tool. What do you think on this one? Got some mixed answers, but mostly false. That's right. So we should all know as a team what stage of change each person is in for each behavior, goal, and or substance. And the reason for that is that we all want to be responding accordingly and consistently. So if we don't stage as a team and I think somebody's in pre-contemplation and my teammate thinks they're in action, we're probably going to be doing 2 different things. So stages of change should be a common conversation that you use with your team members to make sure that everybody is on the same page. Now, we're going to do a little activity on stages of change, and here's what I'll say. If you're off by one stage of change, like let's say somebody is using cocaine, but they've cut down, 5 days a week and they're only using 1 day a week. And one of your teammates says, well, that's action. They've started to cut down. They've stopped on 6 days a week. And another person says, well, no, that's preparation because they still use 1 day a week. Guess what? We could argue for either of those stages. I have my opinion on which one it is, but it doesn't matter because as long as we're sort of in the same realm and we agree on the intervention. So then you could say, okay, it could be preparation and it could be action, but let's agree that we're going to use the same approach, which is relapse prevention planning, celebrating successes, and so on and so forth. Once the team identifies a person's stage of change, they will know the appropriate course of action and the discussion can be concluded. What do you think? True or false? True or false? That's right, that's false. Because the next step, the only reason, or one of the only reasons we do stages of change is to know what to do next. So once we've identified it, the next the next item on the agenda is how will we respond now that we know the stage of change? Okay, so we just answered this question. What is the purpose of assessing stages of change? It's to know how to respond. It's to know what intervention to have. So I'm going to do a quick example. If somebody is drinking alcohol and they've voiced that they want to stop and they've researched AA groups and they looked at what detox might look like, that person is in preparation. So if I go to that person and talk to them about detox programs, give them a list, encourage them to call, encourage them to put their name on the list, help them decide how they might do that, that would be an appropriate course of action. But if somebody's in pre-contemplation and I do that exact same intervention, what's going to happen? If they say, I'm not interested in stopping, and I say, let's look at detox lists, let's work together on picking one, they're going to look at me and be like, you are not listening. Yeah, they're going to push back and it's not going to work. So that's the appropriate way to use stages of change, is to decide what to do next after knowing what stage of change that they're in. Okay, I'm not changing my diet, nothing will happen. What stage of change is this? Yeah, pre-contemplation. I met with my doctor again to consider meds and get a list of foods to avoid. Stage of change, we could call it action. I'd be fine with that. They're doing something, but preparation. I really don't want to change my diet, but I think my arteries need me to. What do you think? Contemplation, yeah. How about this one? I've been on a better diet for a week and I've started meds. Yes, action. It's been 6 months since I've changed my diet and started meds and my numbers are looking better. Maintenance, yes. I'm done with my diet and I stopped the meds. That's right, relapse, reoccurrence, that's right. Okay, so I'm gonna put something in the chat that y'all can use if you want to. It's just a resource that goes over stages of change and stages of treatment. Let's see. It is in there. So feel free to use that for this activity that we'll end with, or just have it in your notes, or don't do anything at all with it. Okay, we're gonna meet Deirdre.
Christine,
Yes.
where is it?
Oh, you know what? I only sent it to one person. Stand by. See? And thank you for saying that, Tatiana. This should be.
Yeah. There we go. Thank
Okay.
you.
You're welcome. So Deirdre is a young woman staying at a local shelter. Staff try to visit her, but she's ambivalent about getting treatment. She's willing to talk to an outreach worker, but often no-shows scheduled appointments. She struggled for a long time with substance use challenges. She likes marijuana and it helps her sleep. It's my medication and it's been great for me. Deirdre reports alcohol has been a challenge. I really enjoy drinking to be social, but I'm spending too much money on booze. I'm researching AA groups. Deirdre used to use heroin, but is not in over 2 years. I'll never go back to that. She enjoys painting and reading, and she hopes to get her own place. So we're going to do a little poll here. And where do you think Deirdre's at with regards to services, with regards to working with your treatment team? What stage of change is Deirdre in regards to working with your treatment team? Ooh, we've got a mixed answer on this one. I love it. I'll give you a few more seconds here. Okay, I'm going to end the poll in the interest of time. Most people chose contemplation, which is probably what I would have chose. I can see some people might chose preparation because she's meeting with someone. I get that. Again, as long as we're having a conversation about it. But because she's ambivalent, she's no showing and she's willing to talk to an outreach worker, I would say contemplation. But again, if you are 2 stages of change off, that needs further discussion. How about what stage of change is Deirdre in regarding her heroin use? What stage of change is Deirdre in regarding her heroin use? Everyone's getting this one. Okay, give it a couple more seconds. Yeah, she's in maintenance. She hasn't used in 2 years. And the reason it's maintenance and not action is because it's more than 6 months. Okay, what about what stage of change is Deirdre in regarding alcohol use? What stage of change is Deirdre in regarding alcohol use? We got a mixed on this one mostly. Give me a couple more seconds. Oh, we've got a mixed one on this one. So most of you chose contemplation. However, she is researching AA groups. So I might actually call that preparation, but I'd also be okay with contemplation. So she's sort of like on that line in between the two, but researching AA groups might push her to preparation. Okay. And then last one for Deirdre. Oops. Why is that being not kind to me? Julia, can you see if you can launch the poll, Deirdre, for marijuana? I'm not sure why it's not working.
I think because the alcohol one is still up. So let me
Oh, it is? Okay.
stop sharing that one.
Back. Oh, you're right. Okay.
Yeah.
Thank you. What stage of change is Deirdre in regarding marijuana use? This one's one of the easier ones. Okay, pre-contemplation. She has no reasons to change. She has not voiced any reason why she wants to stop marijuana. So she is in pre-contemplation. Okay. Great. Let's do one more activity, right? Practice makes progress. That's why we're doing this. Blake has been diagnosed with alcohol use disorder since age 29. He hasn't had a drink in several months, but slipped up last night after getting written up at work. I messed up. I just needed to be numb. He wants to quit drinking, but has struggled sustaining. Blake struggles with diabetes. I'm not pricking myself or anything like that. I have enough to deal with. I've had diabetes for 20 years and I haven't died yet. His current goal is to get a girlfriend and get married, and he started creating a dating profile. He enjoys basketball and gaming. So what stage of change is Blake in regarding alcohol? What stage of change is Blake in regarding alcohol? Nice. Most of you got that. He's in reoccurrence, so he may still be contemplative. A few of you chose contemplation. He may still feel that way, but reoccurrence because he'd drink again. But we don't know where he's back to. We haven't really asked him. Okay, what stage of change is Blake in regarding diabetes? Okay, I'm going to share results. Yes, he's in pre-contemplation. He has no reason to change. He is saying is not an issue for him. Now, that doesn't mean it would be beneficial for him to address it. We know that it could be, but where he's at is pre-contemplation. Okay, and in what stage of change is Blake in with regards to having a partner or finding a partner, I should say? Nice. So I could see both answers being right. I would choose preparation. He's not actively gotten a partner yet. He created a dating profile, but is he talking to people and active? I don't know, but definitely at least preparation. Great. I love this quote. Change is not an event. It is a process. So some of you have probably already known this information, so thanks for working through that with us. But for some of you, maybe this is new information and learning how to identify each stage of change. Next time we have an echo, Jeff is going to talk about we talked about small ways to respond, but he's going to talk more in depth about how do you work with someone who's in pre-contemplation? What do you do with someone who's, for example, in maintenance? So to be continued. And does anybody have any questions? Questions, comments? Great. Well, thanks everyone. Thanks for playing the games and participating and your input. I really appreciate that. And I will close my screen out.